Welcome to Tenet Healthcare Medical Minute. I'm Julia Yarbough. Today's topic is critical care, and our guest is Dr. Malek, a board-certified interventional neurologist. Dr. Malek is the director of the Palm Beach Neuroscience Institute and is also a member of Tenet's Advanced Neuroscience Network. Dr. Malek, thank you so much for joining us.
Thank you.
So let's talk a little bit about critical care and stroke. What exactly is a stroke?
Stroke is when any of your brain cells die because of some kind of interruption of blood flow to those brain cells. And for every minute that you have a blockage, about 1.9 million brain cells die. So stroke is something that you don't want to have, and if you are having one, you want to identify it and get it treated as quickly as possible.
Are there different types of stroke, and if so, what are those differences?
The two major categories of stroke are ischemic, which is when there's a blockage of a blood vessel, and hemorrhagic, which is when there's bleeding within the brain.
Warning signs of stroke. What are some of the primary medical conditions that individuals should be aware of?
In the continental United States, 770,000 people have a stroke every year. Of those, almost 700,000 of them are preventable because they're caused by high blood pressure, by diabetes, high cholesterol, people that smoke, people that have an irregular heartbeat that aren't on blood thinners appropriately, and people that drink too much. 700,000 of them can be prevented just by taking care of those few things.
Talk to us a little bit about the various treatments.
The single most important thing is identifying that there's something wrong with you or with your loved one or whoever you're around, and that is specifically having a sudden change in something that normally worked and doesn't now. So going blind in one eye, suddenly losing the strength or sensation in one half of your body or another. And the sooner you get treatment, the smaller the stroke can be and you can potentially recover. The worst thing that people can do is say, well, I know something's really wrong, but I'm going to go to sleep, maybe it'll be better tomorrow, because there may not be a tomorrow for them.
Talk to us a little bit about your institute and why all of this works so well to save patients.
So as a comprehensive stroke center, we have access to essentially every technology that's available to try to reduce the size of a stroke as well as prevent strokes. We have an entire team of people that extends from our neurologists, our neurointensivists that do the critical care, to interventionalists like myself, where we essentially can take from the moment a person comes in having a stroke to the moment they go to rehab. We've done everything we can to minimize their stroke.
All right, Dr. Malek, thank you very much for that information. Very helpful.
Thank you.
Thanks. And thank you so much for joining us. I'm Julia Yarbough. For more information on Tenet service in Florida, please visit us at tenetfloridainternational.com or call toll-free at 1-855-854-4868.